now going to go ahead and prepare for my wound assessment. So I'm going to go ahead and hand sanitize. And here on my rolling cart, I'm outside the patient's room. Once I hand sanitize, I'm going to go ahead and grab everything from my drawer that I need for my wound assessment. And once I do that, I'm going to go ahead and get my mask on. Then I'm going to go ahead and hand sanitize. And once I do that, I'm going to grab my gown. And I'm going to go ahead and get ready to get inside my gown. So I'm going to put one arm through and the other arm through. And once I do that, I'm going to go ahead and tie my gown. On the back, I'm going to go ahead and tie it as well. And once I've done this, I'm going to go ahead and hand sanitize again. So I'm going to hand sanitize, and then I'm going to go ahead and put on my gloves. And once I have that one, I'll go ahead and get my other one. Go ahead and get my other glove on. And then I'm going to go ahead and get my tray, and I am ready for my wound assessment. Knock, knock, knock. Hi, Mr. Smith. My name is Izzy, and I am a student physical therapist. I'm going to be helping you with your dressing change today. Is that okay? Okay, good. So, Mr. Smith, what I'm going to do is I'm going to go ahead and use your bedside table to set up my area so that we can get ready to clean. Is that okay with you? Okay, great. So what we're going to be doing today is I'm going to be changing that dressing of yours. I'm going to go ahead and measure your wound. I'm going to take a photograph only with my phone that'll be automatically updated to your patient chart. So it's not going to stay on my phone. Does that sound okay? Okay, so we're going to do that so that we can make sure that we evaluate the best way for your wound to heal. So Mr. Smith, on a scale from 1 to 10 today, 1 being the best and 10 being the most pain, what pain level are you at today? Okay, a 4 out of 10. All right, well that's good. Just let me know throughout as we go today if you're in any pain or uncomfortable at all, and we can make adjustments how we need to, all right? All right, so the first thing I'm going to do is spray down my bedside table, and then I'm going to go ahead and wipe it down. I also have a trash can that I have a special pink liner in it, Mr. Smith, to make sure that anything that I throw away today that I take with me before I leave. Okay? Awesome. So what I'm going to do now is go ahead and take off my gloves and throw them away. I'm going to hand sanitize, and then I'm going to go ahead and put the gloves back on. So what we're going to do first is I'm going to go ahead and grab my check pad and make sure I open it up away from me, only to make sure I grab the corners away from me, and go ahead and lay it down. Perfect. So once that's there, I'm going to go ahead and make sure that I dump everything out of my baggie and I throw them away. So when we do this, we want to make sure that we're not shaking, but that we're just dumping. And again, just trying to make sure I just dump it all on my clean field. Yeah, Mr. Smith, there's a lot of stuff we're going to use today. And taking the corner. Perfect. All right, so after I do that, I'm going to go ahead and take my gloves off, and I'm going to hand sanitize. Mr. Smith, what are you excited to get back to once you get out of the hospital? Oh, your motorcycle riding. And I'm going to put my gloves back on. Now I'm going to go ahead and grab my saline, outside of my saline with one hand. And I'm going to go ahead and with my clean hand, grab it, and I'm going to pour my saline. And I'm going to put this down and put my saline down and go ahead and take off my gloves and hand sanitize again. And then put new gloves back on. Mr. Smith, that's awesome. I'm glad that you're going to be excited to go motorcycle riding. That'll be awesome. Once I have new gloves on, I'm going to go ahead and uncover my wound. I'm just going to roll this down. Mr. Smith, let me know at any point in time if you're cold and I can give you another towel. I'm going to go ahead and tuck this under so that we can get some nice, good look at that wound that we have on the table. And I'm going to go ahead and grab my second check pad and opening it up away from me. I'm going to make sure that I bring it back down, and I'm going to make sure that that's laid right by our wound so that we can be ready to go. I'm going to go ahead and take off my gloves and hand sanitize at this point. And I'm going to go ahead and pull off the dressing with one hand, and I'm going to go ahead and take that down. I'll be very careful to glove off with the hand that touched the old dressing, and then I'm going to make sure that I hand sanitize and re-glove, and then I can go ahead and grab my gauze pad, and now we are ready to go ahead and work on the wound.